Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community. And today I am talking with Dr. Carmen Larsen. She is the clinical assistant professor and site director of Vernon Integrated Community Clerkship at Vernon Jubilee Hospital. Welcome, Carmen.
Thanks, Sharon. It's good to be here.
So tell me a little bit about your role.
So my role is the University of British Columbia Faculty of Medicine has satellite training sites for year 3 students. So these are third-year medical students at UBC, and they have an opportunity to go to 7 different sites across the province to do their clerkship instead of being in one of the tertiary care centers. And Vernon is one of them. So we've had this program in place since 2011, and we've grown from 2 students a year to 4 students a year, including one who goes to Revelstoke for half the year. So we are the hub for medical education here at Vernon Jubilee Hospital.
So of the students that have done their residency here, how many have come back and become doctors at VJH?
Well, that's a really great question that I'm happy to answer. Not all of them come back to VJH, certainly back to the interior health or work in rural and remote regions. There is a 5 to 7 year gap between when students can come back because they have to finish their medical school, complete their residency training, and then find a new position. So we have had one of our first students, Jim Wang. He is now a family practice physician in Kelowna. Erin Sharman is a family practice physician, I believe, in Castlegar. We had Dr. Jacqueline Reed, who did gastroenterology, and she was here at Vernon Jubilee Hospital for about a year and is now working at Kelowna General Hospital. This summer, we're welcoming back Tyler Fanner. Dr. Fanner will be joining our radiology department, and he has lots of links to the Okanagan and specifically to Vernon. We're hoping to bring back another radiologist who will finish his training a year later. We have a locum emergency physician named Dr. Emily Ortel who has been back, and she did her training here. So we're really delighted to start seeing these trainees come back and fill up our staff and our here at Vernon Jubilee.
So do residents get to decide what hospital they're going to do the residency at?
So you're talking about residents and I'm talking about students.
Okay.
So these are medical students, and they do get a choice if they want to do the integrated community clerkships. They do get to put their name in the hat to be chosen to do one. They will be put somewhere. So we have 4 students currently. All of these 4 students come from the different UBC campuses. So there's the Southern Medical Campus in Kelowna. There's the Vancouver Fraser campus, obviously in the Lower Mainland. There's Island Medical Program, which is Victoria, and there's the Northern Medical Program in Prince George. And our 4 students who are here this year all represent students from those campuses. But in fact, one of our students was, raised here, has a family here. We often attract back people who are from our community because they want to be back, they want to practice and work where they grew up and where they live.
That's interesting because earlier in the show we interviewed Dr. Emma Corbett, and she was delighted to be part of this program and plans to become a family physician here once she's done. So
yeah, again, Dr. Corbett is a resident, and so she does have to match to a place across the country. These are my role with the medical students. Is like trying to get them earlier on to see that they want to live in a smaller community.
Right.
But certainly, many of the students the family residency program, as you know, is new this year. They're only going into their 2nd year. And the hope is that some of our ICC students will want to return and do their residency here as well. Residency programs are a trickier way to get into a community. But we're sure delighted to have any level of learners. And I have to say, Sharon, our faculty group here at the hospital is pretty amazing. And I've worked with them now for 11 years. When I started, we only had 2 students. And with the support of our amazing teaching faculty, they're the ones that have allowed us to grow in our ICC program from 2 students to 3 students and now to 4, with one going to Revelstoke for half the year. These are great teachers at Vernon Jubilee Hospital. So for people who want to know about medical education or who would like to teach, we have great people here to do that. And then, of course, building on the fact that we have these undergraduate medical trainees, that's one of the reasons we were able to get the postgraduate trainees, which is the family medicine residents, is that the postgrad program at UBC knows Vernon has great and skilled and dedicated teaching faculty to make that happen.
So how did you get into this?
My husband is a physician in town. He's a surgeon, and to be honest, they were trying to get him to get involved with teaching, and I said that they were barking up the wrong tree, and so I kind of just walked into the job. When I first moved to Vernon 11 years ago, it's been a great way for me when I was new here to get to know all the people, because as the site director, I interact with everybody from psychiatry, pathology, surgery, psychiatry, pediatrics, and I've really had a chance to meet a lot of the people in the hospital, and it's a really great medical community. It's a really nice sized hospital to work at, and to be in my role where I kind of in the touch point. It's a real honor to see how hard my faculty and my medical colleagues work to try and educate and bring up more young doctors who will want to work in these settings.
So when you look at your journey as a physician, and you look at what you're doing now for these students and these residents, what do you want to do differently based on the experience that you had?
What do I want to do differently as an educator to avoid what I went through in medical training? Well, actually, it's an interesting question, because the whole concept of doing an integrated community clerkship is a huge shift away from the traditional way of training medical students, where you go for 3 months in one very specific focus: surgery, pediatrics, internal medicine, and then you leave that all behind and you go to the next. This kind of embedded work with going back to the same patients and going back to the same faculty has shown that students come out of medical school maintaining more empathy, not losing a lot of their altruism that they came in with. They feel connected and part of a team earlier. They don't feel like they're doing sort of grunt work or work that they're not learning from. These students in Vernon, for example, they're not doing any what we call service. They're here to learn and to help. And so it's very different from what most of us went through in training, where it's a bit of a grind and you work really hard and you take your knocks and you kind of suck up, and not everyone's super nice. Here, I think the goal is on wide awake learning, developing relationships with faculty so they can give you better feedback because they know you better, they're invested in you, developing better relationships with families and with your patients. It's a nice way to train. It's very humane compared to what many of us went through.
And what can a patient expect when they get a student or a resident as a physician?
I think, students and residents offer so much value to patients because they have the time to sit down a little bit longer maybe than the attending physician and really dive into how the person is feeling, what they're experiencing, what their illness experience is. They might have time to ask a few more questions that might get more in depth than what a general consultant might be able to do. And they really want to know, and they really care, and they're keen. Like everything they get to do in year 3. This is their first clinical year. Up to this year, they've never really touched patients before. So they come in from all the books and all the learning and all the lectures, and they have to do a blood pressure, and they have to examine somebody, and they have to make decisions and start learning how to make decisions, and they're very excited to do that, and they couldn't do it without the patients. So they're pretty grateful, they're pretty humble, and they're just really like sponges to learn.
So what do you like best about your job?
Oh, that's easy. I mean, the students are great. I love watching the progression of a student who comes in June of one year and watching them work their way through until May the next year and seeing how they really start to develop their professional identity. They just start to make the connections that we want to see in their clinical reasoning. They're taking responsibility for their patients, and they're really growing into that professional role as a healthcare provider. And every single one of them is so different in that role, and they're all high achieving, bright students. That's how they got into medical school. But they're such individuals, and they bring insight every year to me about the human condition and what they see and how we can move forward. So I love watching them go from like nervous early professionals to more confident professionals looking forward to a career and a future, and it's a real gift. I really love that part.
Wonderful. Well, thank you so much for speaking with me today. I was speaking with Dr. Carmen Larsen, the clinical assistant professor and site director of Vernon Integrated Community Clerkship at Vernon Jubilee Hospital, and I'm your host of Docs of Vernon, Sharon Hughes-Geeky. Tune in tomorrow for another great episode of Docs of Vernon. See you then.